India's united battle against COVID-19. The Health Ministry says 17.27 crore vaccines administered so far. 25.59 lakh jabs administered to 18 to 44 age group till now. Notice early trends of plateauing in 18 states and union territories with 82.75 recovery rate. Suggest stringent containment measures to the 5 regions among areas of concern. BJP President JP Nadda writes a letter to Congress President Sonia Gandhi, expresses disappointment on the behavior of the Congress leaders during the ongoing COVID crisis, says Made in India vaccine is a matter of national pride, but the Congress leaders are trying to ridicule it and create doubts in people's minds. Prime Minister Narendra Modi speaks to his Bhutanese counterpart Dr. Lote Tshering over the telephone. Bhutanese Prime Minister expresses solidarity with India in the war against COVID. The Prime Minister conveys gratitude for the wishes and support. Oxygen Expresses continue to distribute life-saving oxygen to different parts of the country. The first Oxygen Express arrives in Bengaluru from Tata Nagar. Trains arrive in Lucknow, Sagar, Kanpur and Faridabad carrying liquid oxygen. In international news, a major step in the fight against COVID, the US has authorized Pfizer-BioNTech vaccine for children as young as 12 years of age. The FDA says one more step closer towards ending the pandemic. The pandemic situation shows improvement in various countries. The US reports its lowest weekly cases since September last year. France records the lowest daily cases since January. The WHO says that the pandemic is plateauing and declining further in the number of deaths and cases. Namaskar and welcome to the news. My name is Mark Lynn. Here's our top story. The Health Ministry on Tuesday has said that nearly 18 states in the country have reported a decline in the number of new COVID cases. These states are, they include Maharashtra, Uttar Pradesh, Andhra Pradesh, Delhi, Rajasthan, Haryana, Chhattisgarh, Bihar and Gujarat. Let's listen.
करीब 18 स्टेट्स और यूनियन टेरिटरीज देश में ऐसी हैं जहां पर या तो एक प्लेटोइंग इन टर्म्स ऑफ केसेस बीइंग रिपोर्टेड या एक डिक्रीज नोट किया जा रहा है, जिसमें मुख्यतः महाराष्ट्र, उत्तर प्रदेश, आंध्र प्रदेश, दिल्ली, राजस्थान, हरियाणा, छत्तीसगढ़, बिहार, गुजरात और ऐसे ही मध्य प्रदेश, उत्तराखंड, झारखंड जैसी स्टेट्स हैं जहां पर कि हम पाते हैं कि या तो केसेस की ग्रोथ जो है वह है उसमें थोड़ी कमी पाई गई है या उसमें एक रिडक्शन नोट किया गया है। जरूरी यह है कि यह स्टेट्स भी कंटिन्यूड फोकस अपना कंटेनमेंट पर बनाए रखें ताकि हम इन्फेक्शन के स्प्रेड को कम कर सकें।
The Health Ministry's Joint Secretary Love Agarwal there, he also mentioned that the number of COVID positive cases are declining in the country. The case positivity rate, which was 19% on the 27th of April, has decreased in the last 14 days. And with continuous efforts by the states, the 11 states showed decline in positivity rate.
डे ऑन डे जो देश में केस की पॉजिटिविटी नोट की जा रही है, तो 27 अप्रैल के बाद हम ये पाते हैं कि 27 अप्रैल पर देश में जो केस पॉजिटिविटी थी 19% थी ओवरऑल देश की, जो कि आज अगर पिछले 24 घंटे का डेटा देखें तो पाते हैं 18%, यानी कि करीब 14 दिन बाद हमने एक ओवरऑल ट्रेंड इन डिक्रीज इन पॉजिटिविटी अक्रॉस द कंट्री नोट किया है। इसी के साथ ही हमने एक और एनालिसिस करी है तो पाई है बिकॉज ऑफ द कंटिन्यूड एफर्ट्स बाय द स्टेट, 11 स्टेट ऐसी हैं जहां पर वीक ऑन वीक पॉजिटिविटी में भी रिडक्शन नोट किया गया है। लेकिन हम आप सबसे फिर से यह रिक्वेस्ट करना चाहेंगे, जब हम कभी भी एक इन्फेक्शियस डिजीज से डील करते हैं तो हमारे एफर्ट्स कंटिन्यूड बेसिस पर लगे रहें। हम एक दिन भी कहीं भी ढिलाई बरतेंगे तो इन्फेक्शन फैलने का खतरा बना रहता है, जिसलिए जरूरी है कि एफर्ट्स में कोई भी कमोबेशी ना हो।
And speaking on the supply of vaccines, the Health Ministry said that around 17 crore doses have been supplied free of cost to the states. He added that 25.59 lakh doses have been administered to people in the age group of 18 to 44.
करीब 17.01 करोड़ डोजेज देश में वैक्सीन की गवर्नमेंट ऑफ इंडिया द्वारा फ्री सप्लाईज के रूप में स्टेट्स को प्रोवाइड की गई हैं, जो कि लोगों को मिल चुकी हैं। इसी के साथ ही हमने स्टेट्स के साथ कोलैबोरेट करते हुए 18 से 44 साल के जो लोग हैं, जिनको कि स्टेट डायरेक्ट परचेज के थ्रू या प्राइवेट सेक्टर डायरेक्ट परचेज के थ्रू प्रोवाइड कर सकता है, उसको भी फैसिलिटेट करते हुए हम देखते हैं कि करीब 25.59 लाख डोजेज उस एज ग्रुप को भी दी जा चुकी हैं।
An additional secretary in the Ministry of Home Affairs, Piyush Goyal, said that the central government is working in collaboration with the states and union territories to fulfill the requirements of oxygen supply.
वर्चुअल सेंट्रल कंट्रोल रूम सेटअप किया गया, जिसमें भारत सरकार तथा स्टेट्स यूनियन टेरिटरीज के सीनियर ऑफिसर्स हैं, जो कि अपने आपस में इंफॉर्मेशन एक्सचेंज के साथ साथ कोई भी अगर प्रॉब्लम आती है तो इमीडिएटली फ्लैश करते हैं और उसका तुरंत सोल्यूशन रियल टाइम बेसिस पे राउंड द क्लॉक किया जाता है। और भारत सरकार स्टेट्स और यूनियन टेरिटरीज की गवर्नमेंट के साथ बहुत क्लोज कोलैबोरेशन में काम कर रही है और बाकी स्टेक होल्डर्स के साथ भी, जिससे कि ऑक्सीजन की उपलब्धता पूरे देश में की जा सके।
The BJP's National President JP Nadda has asked the Congress party to stop misleading people and creating false panic over COVID-19 pandemic. In a 4-page letter to the Congress President Sonia Gandhi, Nadda asked her if she and her party are trying to weaken this fight against COVID-19. He alleged that the conduct of its leaders, including Rahul Gandhi, will be remembered for duplicity and pettiness. Nadda also wrote that the COVID vaccine dose, it does not belong to any particular leader or any party, and still the Congress is continuously politicizing it. He added that the Made in India vaccine is a matter of national pride. Instead, the Congress leaders have tried to ridicule it and create doubts in the minds of people. Even the chief ministers belonging to Congress party have indulged in such antics. On the Congress's opposition to the Central Vista project, JP Nadda said the need for this new parliament was raised during the Congress-led UPA rule, and he added that the then Speaker Meera Kumar had underscored the need for a new parliament building. Prime Minister Narendra Modi today had a telephonic conversation with Bhutanese Prime Minister Dr. Lothe Tshering. Both leaders spoke about the prevailing COVID situation. The Bhutanese Prime Minister expressed solidarity with the government and the people of India in the fight against the recent wave of COVID-19. Prime Minister Modi conveyed his gratitude to the people and government of Bhutan for their good wishes and support. He also appreciated the leadership in managing Bhutan's fight against the pandemic and extended his best wishes for the continuing efforts in doing so. Also, the leaders noted that the present crisis situation has served to further highlight the special friendship between India and Bhutan. Moving on, the national capital has registered the lowest daily COVID-19 test positivity rate on Tuesday since April 16 this year. The capital continues to witness a drop in new coronavirus cases. On Tuesday, Delhi registered 12,481 new COVID-19 cases. The test positivity rate came down to 17.76%. The national capital at present has 83,809 active cases. Meanwhile, Telangana will go on a complete lockdown from tomorrow, that is the 12th of May. The lockdown imposed by the state government to restrict the spread of COVID-19 will be effective till the 22nd of May. There will be a relaxation from 6 a.m. to 10 a.m. The decision of imposing the lockdown was taken during a cabinet meeting held today. The Karnataka Chief Minister B.S. Yediyurappa inspected a COVID war room at Magadi in Bengaluru West, and he reviewed the bed management system. The war room in Karnataka, it was set up by the BBMP and the Health Department to facilitate bed management and other coordination between various agencies. The war room is managed by volunteers and operational 24 hours a day. The BBMP has made the bed allocation system more transparent through a live portal to display bed availability.
Our war rooms are working as model to the entire country. and their management system is very meticulous. I have got details about the bed occupancy, and it shows that more than 503 patients have occupied beds for more than 20 days. There were 3,000 beds and now 12,199 beds available. Karnataka also received oxygen containers with the arrival of first oxygen express today. 6 cryogenic containers carrying medical supplies, and each container carried 20 tons of liquid medical oxygen, and total of 120 tons was delivered by the center.
The government of India is expeditiously delivering global aid of oxygen concentrators, cylinders, generation plants, and more than 3.4 lakh remdesivir vials to states and union territories through the whole of government approach. And Indian Air Force IL-76 aircraft, it airlifted oxygen containers from Jakarta. Transfer of personnel of Indonesia's defense forces on completion of service courses in India was also undertaken. Airlift of medical supplies from France, Singapore, Amsterdam, and within India continues. As India battles COVID-19 pandemic, the Indian Railways continues its efforts to provide much-needed aid across the country. In order to provide relief to COVID-19 patients, the first oxygen express to Karnataka arrived in Bengaluru today. It carries 120 tons of oxygen containers. The containers were sent from Tata Nagar in Jamshedpur in Jharkhand yesterday. The oxygen express from Tata Nagar reached via the Green Corridor. The train has brought 6 containers of medical oxygen. Another oxygen express of the Indian Railways serving patients with positive efforts has reached Lucknow, and this is it's loading liquid oxygen from Tata Nagar. And on the other hand, in order to maintain oxygen supply for COVID patients, the oxygen express, another oxygen express reached Kanpur from Durgapur. An oxygen express from Rourkela reached Faridabad. Another oxygen express. These trains, they are running across the country, and they are ensuring uninterrupted access of oxygen for patients who are affected by COVID-19. At the same time, the Madhya Pradesh government has also received another lot of oxygen, and this is through an oxygen express which reached Sagar from Bokaro. Defense Minister Rajnath Singh arrived in Lucknow and visited the COVID hospital set up by the DRDO, the Defense Research and Development Organization, and also Hindustan Aeronautics Limited, HAL. So he visited the makeshift COVID hospital at the Hajj House in Sarojini Nagar area. The Uttar Pradesh Chief Minister Yogi Adityanath was present. The 255-bed hospital, it was set up by HAL in collaboration with the UP government to treat patients.
यह 255 ये बेड्स का ये बनकर ये कोविड हॉस्पिटल यहाँ पर तैयार हुआ। इसके पहले हमारे मुख्यमंत्री उत्तर प्रदेश योगी आदित्यनाथ जी ने DRDO का जो लगभग 500 बेड का जो कोविड हॉस्पिटल बना है उसका भी उन्होंने लोकार्पण किया था। यहाँ पर जो लगभग 25 वेंटिलेटर्स और अप्रॉक्सीमेटली 100 के आसपास यहाँ पर HFNC यानी जो क्रिटिकल जो केसेस होंगे इनके ट्रीटमेंट की यहाँ पर बहुत ही अच्छी व्यवस्था की गई है। आज इसका निरीक्षण करने के लिए हम लोग आए थे।
The Defence Minister also said that the UP government has shown alertness in handling COVID. If someone sees faults and makes suggestions, the government welcomes it.
उत्तर प्रदेश सरकार ने पूरे उत्तर प्रदेश में कोविड से संबंधित मामलों को हैंडल करने में जितनी तत्परता दिखाई है उसकी जितनी भी सराहना की जाए कम है। खामियां किसी से भी हो सकती है, जो करेगा उसी से कहीं कोई चूक हो सकती है, लेकिन मैं समझता हूं कि आलोचना और प्रत्यालोचना का समय नहीं है। यदि कहीं पर किसी को कोई कमी दिखाई देती है, यदि वो अपना सुझाव भी देता है, तो मैं समझता हूं प्रदेश सरकार भी स्वागत करेगी और हमारे इस देश के माननीय प्रधानमंत्री श्री नरेंद्र मोदी जी के द्वारा भी इस क्राइसिस को चैलेंज के रूप में स्वीकार किया है और इस चैलेंज को मीट आउट करने के लिए जो भी इफर्ट हो सकता है वो सरकार कर रही है।
The Union Minister of State for Finance and Corporate Affairs, Anurag Thakur, handed over 7 oxygen concentrators to a Residents' Welfare Society of the state, Himachal Mitra Mandal, and they will provide patients in Delhi with oxygen. He said that India will surely win this fight against COVID-19.
कोरोना से जंग जीतेंगे हम, ये हर भारतीय और हर दुनिया के हर व्यक्ति का यही संदेश है, क्योंकि इस लड़ाई से जीतना जरूरी है। राजधानी दिल्ली में जिस तरह से केसेस बढ़े, यहाँ पर ऑक्सीजन की कमी भी आई। जो हिमाचल की यहाँ पर संस्थाएं अच्छा काम करती हैं, हमने उनको कहा कि आप भी आगे आइए। उनकी ज़रूरत थी ऑक्सीजन कॉन्सेंट्रेटर्स की, और हमने इन सब संस्थाओं को बोला कि चाहे वो हिमाचल का हो या गैर हिमाचली हो, इन संस्थाओं के माध्यम से उनको लाभ मिल सके, ऑक्सीजन कॉन्सेंट्रेटर घर पर मिल सकें, ताकि वो अपने घर में रहकर भी अपना इलाज कर सके।
The Uttar Pradesh state government has initiated house-to-house active case finding of COVID-19 in rural areas. This is to contain transmission by testing people with symptoms for rapid isolation, disease management and contact tracing. The WHO has extended support to the UP government on the compilation of final reports. WHO supports the Uttar Pradesh government in training and micro-planning of the activity. The WHO has also now deputed field officers on the ground to monitor and share real-time feedback with the government. This is for the immediate corrective action to ensure quality. And government teams are moving across 97,941 villages in 75 districts over 5 days for this activity, which began on the 5th of this month. Those with symptoms are tested and they're given medical kits, as well as information on quarantining and also on isolation, both at home as well as in hospitals. So people without signs of COVID-19, they are urged to get themselves vaccinated, follow COVID protocols, behavior patterns, and also to prevent the transmission in rural areas, India's most populous state, Uttar Pradesh. To protect the poor people of the country from the impact of the lockdown due to COVID-19, the centre has announced the Pradhan Mantri Garib Kalyan Anna Yojana. It's proved to be a boon to many. In Karnal, in fact, beneficiaries are being provided 5 kilograms of food grains per month per person. And also the beneficiaries, they have expressed their gratitude towards the centre for this.
Amid the corona pandemic, in order to provide free food grains to the beneficiaries, the centre relaunched the Pradhan Mantri Garib Kalyan Anna Yojana 3. An additional quota of free of cost food grains at a scale of 5 kilograms per person per month will be provided across May and June. Distribution of food grains is going on as per schedule for the month of May, and so far 15.55 lakh metric tons of food grains have been collected from FCI depots by 34 states and union territories for this month. The Pradhan Mantri Garib Kalyan Anna Yojana proved to be a boon for the farmers, labourers and the poor during the lockdown imposed due to the coronavirus pandemic. Beneficiaries say the scheme has been a great support.
ये सरकार ने बहुत अच्छी योजना चलाई है। जैसे अब आजकल काम नहीं है, घर बैठे हैं बच्चे, तो पेट पालने के लिए तो आपको पता ही है राशन तो ज़रूरी है, इसलिए सरकार ने जो योजना चलाई है बहुत अच्छी चलाई है। मोदी सरकार का मैं धन्यवाद करती हूँ।
गरीब जो घर में या वैसे जो है काम बंद है, उसकी सहायता के लिए सरकार ने बहुत अच्छी योजना बनाई है।
मोदी सरकार ने जो ये फ्री में राशन दे रहे हैं, ये इनका बहुत बहुत धन्यवाद है। हमारा कामकाज वैसे ही नहीं चल रहा, हम घर पे हैं।
बहुत अच्छी योजना है, जैसे लॉकडाउन में सभी के काम काज बंद पड़े हैं, ऐसे में केंद्र सरकार का धन्यवाद है, उनका बहुत अच्छा फैसला है ये।
In Karnal, the beneficiary ration card holders are being given 5 kilograms of free food grains per person registered on the card.
ये तो बहुत अच्छा मोदी सरकार का हम धन्यवाद करते हैं। गरीब लोगों के लिए जिनके दिहाड़ी नहीं लगती उनको भी सबको राशन मिल रहा है 5 किलो पर मेंबर के हिसाब से। और हमारे पे 117 गेहूँ आई है और सभी के लिए, और साफ गेहूँ आई है, बिल्कुल कोई किसी बात की दिक्कत नहीं है, ज़्यादातर बढ़ चुकी है।
No doubt the PM Garib Kalyan Anna Yojana proved a blessing for many people in this hard time. Bureau Report, DD India.
Maldepur in Bhalya district of Uttar Pradesh, a community kitchen has been started by the Yuva Chetna. They have the aim to provide free meals to the poor, and for the last 7 days needy people in and around Bhalya and in Purvanchal, they are being provided food by Swami Abhishek Brahmachari and the convener of the Yuva Chetna, Rohit Singh. So according to them, their main aim or their objective is to provide these meals free to the poor and to help the needy.
युवा चेतना ने बलिया के मालदेपुर मोड़ पर जनता की रसोई का स्थापना किया है। हमारा उद्देश्य है कोई भूखा ना रहे। लगातार बलिया और आसपास के जिलों में स्वामी अभिषेक ब्रह्मचारी जी के साथ मिलकर हम हजारों लोगों की सेवा कर रहे हैं। उन तक भोजन पहुंचा रहे हैं, उन तक मास्क, साबुन, सैनिटाइजर पहुंचा रहे हैं। घर पे रहें, सुरक्षित रहें, 2 गज की दूरी मेंटेन रखें, मिलके कोरोना को हराना है।
Some international news now. The US has further extended its vaccination program, providing authorization to emergency use of Pfizer-BioNTech's COVID-19 vaccine for children. The US regulators have given a green signal to Pfizer and BioNTech's COVID-19 for inoculation in children between the age group of 12 and 15 years. The vaccine has been available for under an emergency use authorization to people as young as 16 in the United States. The vaccine makers said that they had started the process for full approval for those ages last week. It is the first COVID-19 vaccine to be authorized in the United States for this age group, seen as an important step for getting children back into schools.
As the FDA announced the expansion of the emergency use authorization for the Pfizer-BioNTech COVID-19 vaccine. This is a big step for our country. Vaccinating a younger population brings us closer to returning to a sense of normalcy and to ending the pandemic. Now, parents and guardians can rest assured that in making our decision, the agency undertook a rigorous and thorough review of all available scientific data, as we have with all the COVID-19 vaccine authorizations.
The World Health Organization has said on Monday that the world was seeing a plateauing in the number of COVID-19 cases and deaths, with declines in most regions, including the Americas and Europe, the 2 worst affected regions. However, the WHO Director General has warned that this plateau is unacceptably high, with more than 5.4 million reported COVID-19 cases and almost 90,000 deaths last week. At least 11 people have been killed on Tuesday and many more wounded after 1 or more gunmen opened fire in a school in the Russian city of Kazan. Some Russian news agencies state that 2 teenage gunmen were involved, and others said the sole shooter took part. According to the news agency RIA, 1 19-year-old gunman had been detained and that an explosion had been heard at the school. And with that, we conclude this news bulletin. Thanks very much for being with us, but always remember, mask up and stay safe. Thanks for watching. Namaskar.